the last 1.5 days, we've been in South Asia and discussing the problem, the international problem. Now, in this session, we are back to East Asia. And I'm very honored to have our group here. The prominent expert in that field in each country. And to my further left is Dr. Patani Winichagun, Associate Professor of Institute of Nutrition, Mahidol University of Thailand. And just immediately left of me is Professor Talim Sudaryanto. Assistant Minister for International Cooperation, the Ministry of Agriculture of Indonesia. And to my right is Dr. Men Sarom, Vice Rector of Royal University of Agriculture, Ministry of Agriculture, Forestry and Fishery of Cambodia. And next to Men Sarom is President Agustin Pulungan, the President of the Indonesian Farmers and Fisheries Society Organization of Indonesia. And to my far left, right, is Esther Penunia, Director General of Asian Farmer Association of Sustainable Rural Development in the Philippines. And I myself is Votong Sun. I used to be the Vice Rector and Professor of Agriculture of the Cần University in the Mekong Delta, where we make the rice happen in Vietnam. And next to that, after that, I established another university also in the Mekong Delta. This is the An Giang University. And now, just 1 month ago, I was assigned to establish the third university in the Mekong Delta, the Tân Tào University. So as you know, in Asia and East Asia, we are fortunate that the climatic condition as well as the soil condition was so favorable to some of the countries and not favorable to other countries in this East Asia. But with the very good water resource in the Mekong River system, and it makes two of the countries in East Asia is the first and second world's largest rice export countries. Thailand number 1, Vietnam number 2. But also we from there, I think Cambodia is going to be another exporter of rice. And of course, we have our two other countries, the Philippines and Indonesia, at this time because of the typhoon, because of all this calamity. Although there are a lot of potential and technology available, still they cannot win the adverse effect of typhoon, of storm, tsunami, and so on and so forth. And during the last 1.5 days, we heard about this nutrition and health problem, and we have found out that malnutrition among the rural populations is a matter of biggest concern. And it seems that we also have pointed out that we have to empower the women, especially young women and the youth. Not to leverage them to work more, but empower them with the knowledge of nutrition, the value of each kind of food around them, so they know how to produce it, and then they can nurture their womb and to feed their baby during the first 2 years. But in the development of East Asia, we see that there are also success stories and also there are failures. Many governments have come up with policies on nutrition and health to improve the situation in their own country. But there are good examples of success. Also, there are examples of failure. So now, first, I would like to call on Dr. Patani Chagun from Thailand to tell us about the success story in Thailand, the PAP program. So may I invite you, Patani?
Thank you very much, Dr. Suan. Good afternoon. Well, this is the biggest challenge that I have ever been given to talk about the Thai program in 5 minutes. So I don't think I can really cover in my presentation as the whole program. So what I decided to do is that I like to bring out key points or key learnings after we have implemented successful community-based nutrition program in Thailand, which the active period has happened during the 80s and at least half of the 90s. When we began trying to think about how to improve, well, first of all, people were surprised to learn that in a rice export country like Thailand, among ourselves, that malnutrition exists. And that's clear then to us that rice alone is not adequate. It's a lot more to do with that. So when we began, actually, there was already a unit of nutrition in health sector. And we recognize that if we let go like that, then it will be very limited. So very key advocacy messages to begin with is that we address that nutrition is not a health problem. It's not a deficiency diseases, but it is the outcome of the social and economic development. And investing in nutrition is a country's investment in human capital and not an expense or not a welfare expenses. The second important point that we learned at the beginning was that in Thailand we did not have a big cadre of nutritionists to begin with, but we recognize that we need some kind of critical masses at different levels. The importance of that is that we are moving the nation. We are not doing just a project in a confined area. So the critical mass then would provide leadership, commitment, critical thinking of the way we do things, and reviewing what we did, whether it's right or wrong, or shall we improve, and so on. But very important thing that we learned out of that after our success is that we have to be persevere. Doing malnutrition is not something that we can put in a magic bullet solution. And coming from the academic institutions, when we began the program, academicians have important roles to play because it's our baby, it's our expertise. So we have been supporting the National Committee through the Secretariat all along, especially in making the plan available. So the learning point from our first effort, putting the multi-sectoral food and nutrition policy in plan as a national or as part of the national development, I think what we see is that it was important process to mobilize and orienting people, especially key people in various sectors, to come and work together and come up with a plan which is sort of a master plan so that each sector can go back and try to include that in their sectoral plans. Unfortunately, having a multi-sectoral plan is not equally to implementing multi-sectoral program. So we learned that a hard way after 5 years, then we saw no results. We thought we were doing fine because we think about the multi-sectoral. So what happened then? Again, back to the idea that we are moving the whole nation. So that means it's bigger than a project scale. We have to do something in the institutional arrangement or in the infrastructure. Fortunately, high-level policy makers back in late 70s and 80s, while they were preparing the National Development Plan, it was recognized that rural development was important and it needs some kind of effective organization structure and management at the national level, which will be very crucial to strengthen and streamline the resources to allow for the coordination of the multi-sectoral planning and functioning at the frontline levels. Then on the side, we do not oversight the importance of the community because we have had several experiences before then that community empowerment was very important, and only with their participation we couldn't do much because at the time, back in the 70s, Thailand wasn't at where we are economically these days. So you could imagine that we did not have huge fundings. We did not have, although we had some supports from international, bilateral, multilateral, and so on, but we felt that we need to maximize whatever we have available from our own country. So with the experience in some community projects, especially in the area of health, it was recognized that building the capacity at the community level through creating the village health volunteers so that there could be the functioning hands of the community, not the functioning hands of the health sector. And that turned out to be the huge success in that we were able to mobilize training of the volunteers at the ratio of 1 volunteer per 10 to 20 households in each community. So in all, we have about something like 5 to 10 or 15 volunteers, unpaid volunteers. And these people have been working very impressively in the country. As I say, we recognize that to move the program, there certainly needs some financing. This is the toughest, and we knew that the government doesn't have a whole lot. So the community participation became very crucial because they contribute both in terms of the in-kind, in other words, volunteer to do various things for their own communities. And by linking up this macro level planning, streamlining resources, and interface with the community mobilization and actions facilitated by the frontline personnel, we were able to implement nutrition and as well as other components of the primary health care, including like clean water, sanitation, and so on. So in a way, I can say that the actual implementation of nutrition became very holistic as part of the total development rather than putting in specific direct nutrition intervention. So in all, agricultures also have very crucial roles to play. We were not talking about a big macro agriculture policy because most of those goes to cash crops and so on and so forth. But we dealt very much with the extension of agriculture extension in order to help the small people, small farmers to be able to produce food in the community, in their households, in order to address both income and food security issue, And very importantly, last point to emphasize is that we knew that the focus is mothers and children. So we also make sure that all programs have some focus on that. And doing that, we did that by including the nutrition indicator as part of the package of development indicators. I don't have time today to talk about the basic minimum needs approach, but that is sort of a holistic tools at the community level, which nutrition indicator is one of it. And we have this set of approach to mobilize the community more fully in an integrated manner. So all in all, I think the success of the Thailand program really have been contributed by the community people themselves, not as much us. So we stay behind, support them, and get them to be able to do the important work themselves. Thank you.